me invite Dr. Kunal Punamiya, CEO, SL Raheja Hospital, a Fortis associate. Can I invite Dr. Kunal to come on stage, please? A huge round of applause for him. Let me invite Dr. Nilesh Singh, COO, MRR Children Hospital. May I invite Dr. Nilesh Singh, COO, MRR Children Hospital, to come on stage, please. Huge round of applause for him. Dr. Clive Fernandes, Group Clinical Director and Group COO, Wockhardt Hospitals. Dr. Clive, you can also join us, please. Huge round of applause for him. Dr. Hardik Ajmeria, Medical Director, Saifee Hospital. Thank you so much for joining us today. And let me invite Sweta Sharma, Segment Head Building, Schneider Electric, to join us on stage, please. A huge round of applause for her as well. And can we have a chair on stage, please? Thanks, Sweta, for joining us today. So, without taking much time, I know we are running short of time, but we are running late. Let's come to the point. Let me ask Dr. Kunal Punamiya, who is the CEO of SL Raheja Hospital, the Fortis associate. Dr. Kunal, what, according to you, is the concept of digital hospital of the future? What does it mean to you?
When you talk about digital hospitals, basically, what is the role of digitization? It is basically to have lesser interaction levels with people and have more automated system. Somewhere down the line, when we look at technology in hospitals, we only keep on looking at high-end equipments and gadgets which are for doctors. But somewhere down the line, we start to need to invest in technology which is going to touch patients. How can you ensure that if a patient wants to seek an appointment, he can do it digitally, paid digitally, just come, show probably a barcode, scan it, and go and attend to go and meet the doctor who he wants to meet. Accordingly, if a prescription is generated, like a bill is generated in any other place, if a prescription is generated which comes to him on his SMS, which he goes to the pharmacy and he scans it and he can get the medicines. Life becomes a lot simpler for him. And that is where he gets the wow element. If a patient is admitted in the ward, there's so many interactions that they happen with nurses and the housekeeping staff. But half of the time we are talking about call bells, and a person will come attend to the call bell and then probably go back and call the relevant person. Can he actually ask for the service directly? What he wants. If he wants a nurse to attend to him, can he ask for the nurse? If he wants someone to help him with a pot, can he ask for that relevant service? These type of digitizations, even the billing part, he can have an update. These things will not only improve his satisfaction levels, there would be more transparency in the transactions, and probably you will also invest less in your overall operations, making yourself more efficient in how you function.
So, if I can take a crux of what you said, less of interaction, more of automation, resulting in increase in efficiency.
Exactly.
Thank you so much. Let me take a perspective from Dr. Nilesh Singh from MRR Children Hospital. Also, the same question to your thoughts and vision on the digital hospital of the future and how it can transform healthcare.
So, if we see digital hospital, I think digitalization is the future of everything. And when we talk about hospital, as Dr. Kunal, we have to see not only engaging, making EMR, but we also have to ensure that we make the clinician, empower the clinician to take a proper decision, in which we integrate all the EMRs, all the digital radiology diagnostics, which is available to the clinician at just a click, which enables him to take a proper decision making for treatment. Second, digitization can be used to empower the patient in order to have an access to all his records, all his clinical decision making. Everything is there. Taking small aspects, like as Dr. Kunal said, just we all have a problem of a patient waiting in queues and a waiting period time of patient. If we can digitize that, a patient can probably do the registration at home itself. pay by a QR code. He just needs to come, at the hospital, scan his QR code and make him present and directly go into the queue rather than standing in the entire line of, standing behind people and waiting for his turn to come. So that's what is digitization, what we should look at. Digitization is going to touch base every aspect of the hospital. It's not just going to be the patient care. It will be like Dr. Kunal said, for the basic services. Right now, since we in India are healthcare professionals getting in healthcare, we all will agree that it's a challenge getting trained professional in healthcare. We all are struggling with it. So if we can look into that and we can digitize it entirely to reduce, and optimize our patient healthcare by making nursing enabling nursing, we connect all the devices so that entire data can be seen by the nurses digitally. Housekeeping can be efficient. Porter management system, a very simple thing which if it is digitized right now, we have all seen that we have reduced the cost of transport of medicine going up and down, using manpower for doing it. So that's what I will look for digitization in every aspect of the hospital.
Digitization at every aspect of the hospital. There's no running away from that. But again, how to use that technology efficiently, that is the goal. Let me take a perspective from Dr. Clive Fernandes, Group Clinical Director and Group CEO, Wockhardt Hospitals. Sir, maybe electronic health records or telemedicine platforms, whatever digital technologies we're talking about, how do you think that can improve the coordination or communication or continuity of care across the departments in a hospital chain? Your thoughts on that, sir?
Okay, first of all, good afternoon, everyone, and thank you, APAC, for this opportunity. We talked about digitization. How many of us heard the term IoT? I've been sitting in the room for the last 2 hours, and I just thought if we had an IoT which said, "Is it cold now?" How many of you are really feeling cold? A lot of us would have put up our hands. Coming back to your question, when you talk about digital, I would like to sum it up as digital is about work smart. Don't work hard. That is what it ultimately is. And if you heard most of our speakers now in the morning and people later also, we all agree. So it's about work smart, don't work hard. Costs and all are secondary. Now we talked about electronic medical records. So I will just focus on electronic medical records, although digitalization has so many different aspects. How many of us have actually seen a doctor's handwriting and say it is legible? Now we talked about continuity of care. So someone talked about errors, someone talked about cost. And at the end of the day, we have to look at an outcome, a safe outcome for a patient. So when you talk about an electronic medical record, just look at how many benefits happen by making it electronic, access. What is my hospital in South Mumbai is 20 floors. If I want a medical record, which is a hard copy and it is in the basement, सुबह से शाम हो जाएगी उसको आने में. So first of all is accessibility. Now it is not about me on the 20th floor and someone on the ground floor. Accessibility of all healthcare information to every provider at the click of the button. That is very important. So many times updates happen later. So when you talk about digitization, medical records, how does it help? Easy accessibility to all stakeholders. Spontaneous update. And the best thing is, reduction of errors. Now, at the end of the day, Dr. Parag was talking, we were just talking, everyone is looking at the West and the West is looking at us. It's not about only digitization. Our goal at the end of the day is safe outcome and efficient outcome. So if you look at any of the digitalization techniques or whatever, Kunal, Nilesh and anyone spoke, we are trying to make the systems efficient.
Right. End of the day, our sole aim is that making the system efficient, and to do that, we have to work smart and leverage technology, but at the same time, accessibility to the data, that is very important, and how to use that data. There is no dearth of data in today's age, but at the same time, how well we can use that data for our own benefit, that is also important.
And I wanted to just take 30 seconds to answer the second part of your question, telemedicine. Now, telemedicine did not come during COVID. It has been here for donkey's years. We all know that. It just actually people really realized the importance of it during COVID. But again, I'll play devil's advocate. Because of COVID and because of Zoom calls and telemedicine, today I'll tell you the real customer actually wants to go to the OPD. He does not believe in the Zoom call. But telemedicine has actually taken healthcare to remote places where it would not go. And that is the importance when you look at people talk of hub and spoke, blah, blah, blah. It's all about connecting, small nursing homes who have ICU patients but don't have the expertise. You link them up via telemedicine and via the IoT of things where you're giving all the parameters to some big hospital where there is an intensivist who can just look at it and guide care. So that's how technology can help.
Right, right, right. Let me ask Dr. Hardik Ajmeria from Saifee Hospital your thoughts on how these technologies can help in the uh, outcome, patient outcome, or enhancing patient's experience in hospitals.
Okay. Thank you, APEC, for inviting me here. And thank you to my co-panelists and members of this August audience here for this thought-provoking session. Just giving a small context to the topic here. When I was, when I came to know of this topic, hospitals of the future, I became nostalgic thinking of an old science fiction movie, Back to the Future. Okay, where we had seen time travel, we had seen flying cars, we had seen robots doing surgery. As a child, I was very fascinated and I thought, will this ever really happen in the real world? Today, 15 years down the line, yes, we have seen it all happen. We have seen flying cars being made. We are seeing, I am also seeing in my hospital robots doing surgery. Okay. And okay, time travel has still not happened. Sorry for that. Yeah. But again, there is a catch here. Although flying cars have been made, how many of us have actually sat in it? I actually have not. Even though robots are doing surgeries, how many hospitals are able to afford it? So the catch here is, though the technology, what we have once dreamt of, is now ready, how do I implement it? How do I implement it for patient care, for patient benefit, in order to, of course, reduce the mistake errors, reduce the mistakes, improve the quality, improve the delivery, and so on. So the problem here is that yes, we are ready with the technology. We are very interestingly poised, the entire healthcare ecosystem. We are on the edge of a locked door to the future, which is digitized. However, to unlock that door, there are many challenges which we first need to navigate, which is the challenge here. So going ahead, now if we are able to do it, which we have been able to do it partially. Partially, we have been able to achieve what? We have been able to achieve robotic surgeries. We have been able to achieve the voice to text software. We have been able to achieve another parameters like, okay, AI in X-rays, maybe rapid AI in stroke, all these things, again, at a cost, we have been able to achieve, and that has transformed the healthcare delivery. All the parameters, what you have mentioned here, patient safety, operational management, staff management, patient experience, everything has improved because of that. However, the challenges of cost constraints, the sharing of data via interoperability, which means upgrading to HL7 and HIPAA compliant systems, um, data privacy issues, and most important, even if we can achieve all this, the the resistance to change, the way we are going ahead, all this has to be taken care of. Yeah. So we are somewhere, we have created the car, flying car, but now we need to sit in this car, number one. And secondly, now that we have created what we thought 15, 20 years ago, what do we want to create 15, 20 years down the line? That thought strategy also has to begin. Thank you.
Right, right. Important part. You talked about affordable technology and whether we are ready to embrace technology in its new avatar, and also identify, also trying to help to change the mindset of embracing that technology. Thank you, Dr. Hardik Ajmeria. We have with us Sweta Sharma from Schneider Electric. I think she's the segment head of buildings. So I'll ask her something about the buildings when it talks about hospital building, Sweta. Uh, if you can give some example or shed some light on how digitization is helping in making the hospital buildings safer. It can be a aging hospital building or a new hospital building, but your thoughts on that?
Okay, so first of all, very good afternoon to all of you, and thank you, APAC, for having me here. Now, to answer your question, Shobik, we heard, I think last 2 hours we have been talking so much about digitization, IoT, and digitization influencing different systems in the hospital or in a healthcare facility. So if you ask me, from a technology perspective or from a technology provider perspective, I would say digitization needs to happen at a system level. When I say system level, it means it needs to connect multiple subsystems and not only just one system. So digitization is helping us become more efficient. How? First of all, it brings us transparency. We have so much data. We have, IoT devices everywhere. In fact, the devices are being replaced with the IoT-enabled devices. So much of data is coming into a system. And then what do? We see some dashboards, and then what? So the transparency is very important, and that's what makes us more efficient and resilient. It's time that we start talking about using these data to leverage our decision making capabilities, get more actionable insights from these data, use artificial intelligence algorithm on these data to understand the trend or to understand what can go wrong, and get into a predictive and more on the condition based rather than just being reactive. So that's very important when we talk about digitization. How much are we leveraging it apart from just connecting devices to an interoperable platform? What else are we doing? So bringing transparency and hence becoming more efficient is what I think digitization has the capability to do.
Using data for decision making, a very important part you have raised, Shweta. And also, you talked about digitization can only be successful if we see at the system level. When you talk about system, that it has to be done together. We should not see it in isolation or in a silo. Very important. I'll start with you because we have to wrap this session. Let me start with you quickly. 20 seconds to you, Shweta. If I may ask you your tech vision for building sustainable and resilient hospital ecosystem or health infrastructure, quickly to you.
So you have touched on my favorite topic, which is sustainability. So I try to summarize it in 20 seconds. Okay, so sustainability is becoming more greener, that is one, but then it comes with becoming more efficient as well. So the moment you start using less energy, less effort, obviously your emissions and carbon emissions, etc., greenhouse, etc., is going to reduce. So digitization will also help you become efficient and hence make your facility more sustainable. Now, digitization need not be only in the operational stage. Digitization has to get into throughout the life cycle of any facility, starting from the planning to the build stage, to the design stage, then build, manage, and then operate stage. And that's when we see true benefit of digitization.
Right. Let me take a perspective from Dr. Kunal Punamiya. So, your thoughts on the future of tech vision for the future when it comes to building sustainable and resilient healthcare infrastructure?
As I said earlier, it has to be patient centric. It has to be something that is going to impact the patient, and he feels that yes, this technology is working in my favor. It has to enhance his experience. It has to reduce his pain points, whether it is the waiting time, whether it is the accessibility to the service, whether it is you means a lot of us, whether we are corporates or whether we are government hospitals, we do see some level of bureaucracy everywhere. When I want a document, I want a record, everything is, there is a level of bureaucracy. I have to give an application and then I'll get it. We got to cut that. Things have to become simpler. So while we all enjoy and we relish the way there are apps like Zomato, Swiggy, Dine Out, Amazon, Flipkart, and you say, oh, shopping's become so simple, ordering food has become so simple. Can healthcare become that simplex with all its complexities of the science that it involves? That's important.
Right. Thank you so much. Thank you so much. Dr. Nilesh Singh, your thoughts quickly.
If you the digitization, according to me, it has to touch all the aspect of the hospital. It should be patient centric. It should also enable my clinicians to take a good informed decision for treatment of the patient. Third, it should be also optimizing the operational cost, reducing the errors in the hospital, bring down, because we all know, there are more deaths because of the operational because of the errors happening. So reducing the errors, making the building efficient, making the operational efficiency, and reducing the overall staff management into a perspective where things can be management perspective more easier to control.
Dr. Clive Fernandes, your thoughts.
So everyone has talked about digitalization and sustaining. Take a different path. It takes two to tango. So what about the stakeholder buy-in? And I'll just give you an example. The CPOE came 15, 20 years ago. It was so that consultants write their own medications and medication errors are reduced. Buy-in था ही नहीं कभी. They gave their passport to the resident. उसको पता ही नहीं amlodipine क्या होता 50 mg लिख देता है. To sustain digitization and all the technology we are talking about, we need to ensure staff buy-in. They need to know why this. That also.
Right. Thank you. Dr. Hardik Ajmeria.
So it's Dr. Hardik Ajmeria, by the way. Yeah.
Okay.
Uh,
I stand corrected.
okay. So when we talk about building a resilient and smart hospital, I will divide it into four cornerstones. First would be obviously digitization, which involves EMR, telemedicine, and so on. Second would be AI, which is now coming up. Third would be automation, and fourth would be upgradation in health tech technologies like equipment, etc., and softwares. We discussed that there are challenges in implementing this at hospital level, at society level, at pan India level, everywhere. So we have under all these four parameters we have to inch gradually and try to achieve excellence and move forward inch by inch. It will take a long time, but it's on the right path. For example, if I talk about digitization, or we all spoke about ABHM, how many of us sitting here have a Aadhaar number generated for themselves? I at least have not. How many of anybody has generated Aadhaar number for themselves? No, nobody, right? So that's an eye opener. If we are not generating Aadhaar number for ourselves, we are expecting patients to come to us with Aadhaar number. So let's start somewhere ourselves. Let's inch forward one by one on all the four parameters and try to achieve what we just spoke about, in the entire session. Try to achieve digitization. Let's start at home. Let's generate a Aadhaar number for all of us today.
Right. Thank you. I think some of us do have our number. I think Nia has. Yeah. So, but rightly pointed out, as Dr. Kunal has also said, his concluding remark that why can't the healthcare delivery be like the Flipkart or Amazons of the world? That's what ABDM is trying to do. They are saying that's a UPI moment of the healthcare delivery. But obviously, integration has to be there, and there are challenges, and those challenges have to be addressed. But technology is the answer. There is no shying away from that. But again, how to use that technology, how efficiently, which will result in increasing efficiency. That is important. Thank you so much. Can we have a huge round of applause for a wonderful session on digital hospitals of the future? Let me again thank Dr. Kunal Punamiya, Dr. Nilesh Singh, Dr. Clive Fernandes, Dr. Hardik Ajmeria, and Sweta Sharma from Schneider Electric. Thank you so much. Can we have a group photo? Now you can come on stage for the group photo and join us for that. And quickly we'll move to the last panel of the day. And again, I'm requesting all of our esteemed speakers to stay back because after this session, we have a felicitation ceremony. Thank you so much.